Two of Houston's greatest cardiac surgeons, Dr. Michael E. DeBakey and Dr. Denton A. Cooley, are well known not only for their contributions to cardiovascular surgery, but also for a feud that lasted almost 40 years. But what were they fighting about? In 1951, Dr. Michael DeBakey hired Dr. Denton Cooley as a surgeon at the Baylor College of Medicine. At the time, open heart surgery was just getting started. In this image from 1951, we see Baylor house staff assigned to Jefferson Davis Hospital, and you can see Dr. Cooley. He's on the second row on the far right, standing shoulder to shoulder with Dr. DeBakey, and they are presented as colleagues in this photo. But by the 1960s, tensions were rising between the two. Cooley had grown frustrated with DeBakey's leadership, and in 1962, he founded the Texas Heart Institute using private funds that he had raised. But everything came to a head in 1969 when Cooley performed the world's first implantation of a total artificial heart. The recipient of the new mechanical heart was Haskell Karp, a 47-year-old man from Skokie, Illinois, who suffered from profound congestive heart failure after having 4 myocardial infarctions. Dr. Cooley recommended a heart transplant for Karp, but finding a donor was challenging, and results for this procedure at the time had disappointing clinical outcomes. Dr. Cooley discussed with Karp the option of ventriculoplasty with the backup of a new kind of pump in case that operation was not successful. But this new pump was in Dr. DeBakey's research lab at the Baylor College of Medicine. Now, if we go back to 1968, so prior to Karp's surgery, considerable technical progress had been made with the pump, but success, in terms of survival, had not been achieved in animal experiments. Dr. Cooley reportedly approached one of the research residents involved, an Argentinian surgeon named Dr. Domingo Liotta, and convinced him to join forces in what was said to be a surreptitious attempt for rapid advancement with human implantation. Over the next few months, more animal experiments were performed using valves provided by Dr. Cooley. It was during this time of experimentation that Cooley was ready to move on to human implantation, and he began to search for a possible human recipient. Karp appeared to be a suitable candidate. So on April 4th, 1969, while Dr. DeBakey was in Washington, D.C. to discuss progress on the artificial heart, Dr. Cooley began surgery on Mr. Karp. He first attempted ventriculoplasty, but could not wean him from cardiopulmonary bypass. Cooley then removed Karp's heart and replaced it with the Baylor pump, marking this as the first implantation of a total artificial heart. Dr. DeBakey was shocked when he heard the news and said that he had no knowledge of Dr. Cooley working in this research area and that Dr. Liotta was his own lab staff. An investigation soon began. Dr. Cooley insisted that the Karp heart was an independent design from Dr. DeBakey's work, but other testimony refuted this. Dr. Liotta's drawing of the Karp device was nearly identical to a sketch of the pump from Dr. DeBakey's lab, as you can see in the photo here. It was determined that Drs. Cooley and Liotta had inappropriately taken the artificial heart from Dr. DeBakey's lab and implanted it in Karp without consent of the university's Protection of Human Subjects and Research Committee, and contrary to the stipulations of the NHI grant, which was the grant that was funding the research on the artificial heart. Dr. Liotta's employment was terminated, and he eventually left the U.S. Dr. Cooley resigned from Baylor, and he was censured by the Harris County Medical Society and the American College of Surgeons for his role in the artificial heart case, but he did go on to great success as the surgeon-in-chief of the Texas Heart Institute. And what happened to Mr. Karp? After the surgery, his condition deteriorated, and he was showing signs of organ dysfunction. It was clear he would need a heart transplant to survive. The artificial heart kept him alive for 64 hours until a suitable donor heart was found. However, Mr. Karp died 32 hours after receiving a new human heart from pneumonia and renal failure. The feud between DeBakey and Cooley lasted for almost 40 years. It also inspired competition and pushed new invention and achievement forward. In 2007, the pair finally reconciled and both offered praise to the other for their work and contributions to their field.